We're back with our COVID-19 claim series, and this video is all about ivermectin. So let's get into it. In med school, I learned about ivermectin as a drug that's used to treat parasites. Not viruses, not even bacteria, but parasites. We're talking about things like scabies and lice and tropical worms called strongyloides. And don't get me wrong, it's an amazing drug. It's almost eliminated some parasites from the face of the earth. In fact, its inventors got a Nobel Prize for it back in 2015. We were desperate when this pandemic started. We didn't have vaccines, we didn't have treatments for COVID-19, so when a few lab studies came out showing that ivermectin prevented the virus from replicating in a test tube, it generated a lot of buzz. The problem is that the doses used in the lab studies were 50 to 100 times higher than what's used in actual people. Now later, there were early human studies that suggested a benefit from ivermectin, but unfortunately the major studies turned out to be fraudulent, basically fabricated data, and they were retracted from the medical literature. But the damage was done and a lot of people kept believing in it. There were also positive studies from parts of the world with a high rate of parasitic infections. And that's important because we often treat COVID with steroids. And steroids make parasitic infections worse. So when people got ivermectin at the same time as steroids, they seemed to do better than people who didn't get it. But it wasn't the COVID that the ivermectin was protecting them from, it was the parasites. At this point, we have many studies, and it's clear that ivermectin just doesn't help with COVID.
And even Merck is telling people to cut it out. They released a statement saying ivermectin has no scientific basis for potential therapeutic effect against COVID. There's no meaningful evidence for clinical activity or clinical efficacy in patients with COVID-19 disease. And there's a concerning lack of safety data in the majority of studies. Listen, if a pharmaceutical company says, please don't take the drug we're selling, you should probably listen to them.
The problem is that a lot of people still took the drug, and eventually we ran out of human ivermectin, so people started getting their hands on veterinary ivermectin, which is used to kill parasites in animals, large animals like cows and horses.
When you hear the phrase horse pills, you think it's a euphemism, but in this case, it's literal horse pills.
Yep, and after that, poison control centers got overwhelmed with calls about ivermectin overdoses.
The Mississippi State Department of Health confirming today that, quote, at least 70% of the recent calls to poison control in Mississippi have been related to ingestion of livestock or animal formulations of ivermectin.
People got nausea, vomiting, diarrhea. At high doses, people actually had issues with their balance and even seizures, and they went into a coma. The drug also interacts with all sorts of other medications, including blood thinners. If you want a proven treatment that prevents severe COVID, it's called Paxlovid. Studies show that if you take it within 5 days of your symptoms starting, it reduces your chances of progressing to severe COVID by 89%. But I get it, there's a lot of misinformation out there, and it can be really hard to separate fact from fiction. To help with that, my friends at Digital Public Square created an online game called Know It or Not. It takes you through a series of questions to see how well you can separate COVID fact from fiction. And if you get it wrong, it tells you why. You can check that out at drg.knowitornot.com. You'll also find that link in the description below. As for ivermectin, I think this tweet from the FDA says it all. So no, please don't take ivermectin for COVID. For more health and science info, subscribe to the feed.